All right, so a little bit earlier I spoke to the WHO's Department Incident Manager for Portfolio Response in Malawi, Dr. Mungwira. Mungwira, thank you very much indeed for joining us, and welcome to the program.
Thank you, Peter.
All right, perhaps we can start with this massive immunization campaign. You're planning to vaccinate 23 million children, East and Southern Africa. What has informed this?
So once the case was declared in Malawi, was detected in Malawi and declared a public health emergency, there was a risk analysis that was conducted. And this risk analysis gave information to how we should respond to this emergency. And then that's how we are planning, that's why we are planning to reach out to children who are the ages between 0 to 59 months, simply say under 5 children, and vaccinate them with a supplemental dose to make sure that we boost their immunity, we stop the transmission of the polio virus.
All right, you're talking about stopping the spread. So what has happened since the declaration on the 17th of February? Have there been other cases reported in the country and in the region?
No other cases have been reported. For now, we only have this single case that was reported from Lilongwe. However, we have ramped up our surveillance efforts. We have introduced environmental surveillance, which we hope to put up to scale. And we're also continuing to, this environmental surveillance is supplementing the clinical acute flaccid paralysis surveillance that we routinely do. And we are also strengthening that component of surveillance to make sure that we capture any case if there are in circulation. So we are at the moment collecting samples from environmental surveillance and sending them to regional laboratories in South Africa for testing.
All right. Sure. So this is all in response to that declaration on the 17th. This strain that's been detected in Malawi is similar to one that's been circulating in a province in Pakistan. Does this suggest that this has been imported?
Surely, absolutely. That this case that we do have now, when we do genotyping of the case, it suggests that this is a case similar to the one circulating in Pakistan. And definitely this is an importation of the case into Malawi. Then we also do know that it might have been in circulation for a number of months. And that shows you how resilient and the functionality of the surveillance system in Malawi. So it's a plus that Malawi has been able to take this case that has been in circulation for close to 2 years. And now we know that it is circulating, and with enhanced surveillance, if there are any other cases out there, we should be able to pick them and mount responses, to stop the circulation.
So 23 million children are targeted, but 80 million doses, which means that you're giving them more than one dose. How does this work?
Sure. I'd like to state that in Malawi, we plan to reach 2.9 million children and across the borders with our neighboring countries, Tanzania, Mozambique, and Zambia. We're going to administer 80 million doses. Zimbabwe is going to join in later on with the rounds that are coming forward. But to stress that these vaccination campaigns will happen in 4 rounds. So we're going to reach all the children, protect them with the first round, then after 4 weeks, we'll go again with a second dose, then another 4 weeks, third dose, another 4 weeks, and another 4th dose. So yes, we are going to do 4 rounds, and that will amount to about 80 million doses administered to these children.
So you are targeting, is it every single child? Because I'm guessing many children have already been immunized. Are you re-immunizing them?
Yes. So we do have routine immunization. In routine immunization, children do get their 4 doses of oral polio vaccine and a dose of inactivated polio vaccine, IPV. However, for supplemental immunization activity, a polio campaign in response to an outbreak like this, we need to make sure that the community protection is high enough to curb the transmission, further spread of the virus. That's why we do not take any chances, because one case is one too many, and we're going flat out to protect these children, our babies, with extra vaccination. This is just to make sure that their immunity is up to par and protect them from getting the polio virus.
All right, and I guess that there's no such thing as getting an overdose of a vaccine in this case.
No overdose. So even if your child got the vaccine in routine immunization yesterday, would urge you as a caregiver, you as a parent who love your child, to come and get that extra dose to make sure that they're protected. We do not want to leave any chance here. Polio is a very, very devastating disease. Once you get the paralytic paralysis, it's lifelong, and your quality of life is damaged. We do not want to see that. We want to see a future with children who are polio-free, no paralysis due to polio. That's why we are going flat out to make sure that we reach each and every child in each and every corner of the block, in Malawi, in neighboring countries, to ensure that we eradicate this threat of polio within our block, our region.
How are you going to reach all these children? I'm pretty sure that some kids, some parents just can't get to kids.
Yeah, sure, and that's actually very right. There are other populations that have access issues to health services. But in this case, we are actually conducting a door-to-door campaign. So we will have health workers reaching out to communities, going to each and every house where there is an under 5 child, and providing the vaccine to that under 5 child. So we have had a very coordinated response, WHO together with health authorities in Malawi, health authorities in neighboring countries, and the Global Polio Eradication Initiative partners, to make sure that we have mobilized resources to implement this approach. So we are very confident that we are going to reach each and every child in each and every corner of the block.
Why children under 5?
Oh, so that I think was addressed, as I mentioned earlier, that was addressed through the risk assessment that was done together with the Global Polio Eradication Initiative, WHO, health authorities in countries, from the case that we recorded, and also looking at all the epidemiological factors that addressed the decision to say, okay, let's target children that are 0 to 59 months for this particular response. And this risk assessment is an ongoing process. If need be, and determined by data that's coming in, we might expand the age group of the target. But for now, the target is 0 to 59 months.
Typically, how does polio spread?
So polio is a very, very contagious virus. It spreads through ingestion or eating contaminated food or water. And in most of our communities in this region, we know that safe water is an issue. So protecting our children with these vaccines would be very, very important, because we know that mostly the water that we're drinking, the safety of the water that we're drinking is not always guaranteed. So polio spread through what we call fecal-oral routes, where a child or a person who's infected excretes that in their fecal matter and goes into the water, contaminate the water, and someone down the stream drinks that water and gets the virus itself. Sure.
I know that your campaign is targeting children under 5, but if parents are concerned for their older children, can they come forward? I mean, is it ever too late to get vaccinated or get further doses of these vaccines?
Sure. So for now, we want to stress on 2 things. The risk assessment has addressed us that has guided us that we should really, concentrate on this age bracket, 0 to 59 months. However, we also are strengthening routine immunization to make sure that all the other children get their doses required within the routine immunization session. So that also adds a layer of protection for all the children. For all the children, for now, they are not involved, they will not be targeted for this response. However, as we said, this is an ongoing process. If the risk assessment detects otherwise, we will then extend to reach out to other children.
I know we're getting off topic a little bit because you're focusing on the children, but if I'm an adult and I never had the vaccine, am I vulnerable? Should I go and get vaccinated? What is this status for adults, maybe?
So for adults who never got vaccinated for polio, and hopefully there are very few, in this instance. For adults who never got a vaccination for polio, they are at risk of getting, the wild type of polio and get paralysis from polio. But that is in rare instances because polio vaccine has been a traditional vaccine in many countries for many years. So many adults have actually had access to polio vaccine. But for now, the concentration is to make sure that we protect our children and we have a future that has a polio-free, polio-free world where we don't see any paralytic cases due to this terrible virus.
Talking about routine vaccinations, how has Africa done? I believe that 2020 we were polio-free across the continent. Is that correct?
Yes, that's correct. So the last case of polio in Malawi, for instance, was documented in 1992, before this one. The last case in Nigeria, which was lagging behind, I think, in controlling the virus, was in 2016. And then we maintained a transmission-free period, and we were certified as a polio-free region in August 2020. So our routine immunization, with some challenges, has managed really to reach out to a lot of children and protect them from this polio virus. So we can say that we've done generally well, but there's still opportunities for improvement in different countries.
So COVID-19 has produced a generation of anti-vaxxers. Are you concerned that this might spread to parents saying, I'm not getting my child vaccinated? What's been the response so far, and how are you going to allay these fears?
Sure, that's a very, very valid concern. And we do know that recently we had campaigns that were associated with COVID-19 vaccine, but we are doing our best to make sure that we do social mobilization. We share information with caregivers, with the local leaders, religious leaders, to allay these fears. And also of note is that we're using a vaccine that we already use in routine immunization. So here we're using bivalent oral polio vaccine that we use for our children in routine immunization. So it's not a new vaccine at all. The messaging around that has been quite comprehensive and has been shared widely in local media, national media houses, and also local community radio stations. Sure.
All right. So you're starting at the moment with East and Southern Africa. Is there a plan to do other parts of the continent in the near future?
Those will be determined by continuous risk assessment and how these rounds of campaigns are going to address the information that we're going to collect during these rounds of campaigns are going to address the need for further expansion of the campaigns in 2 other countries. So we do know that other countries have expressed interest to also implement, reactive campaigns to the case that was detected in Malawi. However, that is also being, that would depend on several factors. What is the epidemiological features? What's the economic status as of now? But those things will be looked into on an ongoing basis and decisions being made based on the data that we're getting from the field.
All right. And perhaps finally, I guess you're working in cooperation with countries across the region. So if parents are traveling from Malawi to, say, South Africa, What is the protocol, given that Malawi has been a country with a recorded outbreak?
So for now, we do have one case. We have not identified more cases. We have not identified a sustained spread of the current case. So the current status is that there are no travel restrictions. There are no travel requirements that have been implemented as of now. So people are still able to move from here to other countries without any restrictions, and then similarly from other countries around to Malawi without any restrictions. But there are international health regulations that might require adults in an outbreak area to get vaccinated for polio, to show proof of vaccination for polio, to move from that country to another country. But for now, that has not yet been implemented.
Dr. Mungwira, I guess in conclusion, people have nothing to fear at this stage. There hasn't been a spread that you've recorded, and this round of immunization is more precautionary than anything else.
Well, so first to say that this round of immunization is to really make sure that we do cut further spread of the virus if it's in circulation. And I've mentioned earlier that we have enhanced our clinical surveillance, our environmental surveillance to make sure that if there is any case circulating, we are able to capture that. But also, this particular vaccination campaign is aimed at protecting our children to make sure they do not get paralytic polio from a vaccine-preventable disease where we have an effective, safe vaccine which we've used for decades. So we are doing everything that we can as WHO and health authorities in Malawi and of course in the bloc to make sure that this does not happen and we see a polio-free future for our children. Secondly, I think people should not get too worried as much as we make sure that we get our babies protected and then we also stop the transmission. So yeah, I think we're on the right track, and absolutely, I'm sure we're going to achieve this because the planning has been meticulous, the coordination has been good, both at national, regional, and global level.
Dr. Mungwira, thank you very, very much indeed for your time, and we wish you the best with this round of immunizations. Thank you for your time.
Thank you very much, Peter.